Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Thank you for joining us today. Today, the Orange County Healthcare Agency reported 260 new cases of COVID-19 and 4 new deaths. This brings our total to 7,987 confirmed cases of COVID-19 and 202 deaths to date. Our hearts go out to the families of those who have passed. 1,831 tests were conducted today countywide, bringing our total number of those tested to 702,072. Our healthcare agency as well as private labs are rapidly increasing the number of tests here in Orange County so that we can get a more accurate representation of the rate of spread of the virus. More information on where the general public may find testing may be found on HCA's website at ochealthinfo.com/COVID-test. I am grateful to our amazing healthcare workers and top-notch medical facilities treating this virus. As of today, we have 294 hospitalizations and 142 in ICU. Of these, 22 patients are from out of county. It is my hope these patients will recover soon. As of today, Orange County has 3,726 recoveries, or 46.6% of the total confirmed cases to date have recovered. While this is an estimation, it continues to tell us that Orange County is well on its way to getting out of this situation. While we are not out of this completely yet, Orange County is in good position to continue moving forward, and we have reason to be positive about where we are. Orange County continues to see the lowest rate of confirmed cases and the lowest rate of COVID-19 related deaths comparing to all our neighboring counties and the state as a whole. Overall, COVID-19 positive test percentages are at 4.5%, has decreased from 4.6% last week and 5.1% from 2 weeks ago. Orange County is testing more. Showing a decreasing positive test percentage is a very good sign. From the earliest days of pandemic, Orange County has been a leader. Before even one case of COVID-19 was reported, we declared an emergency and sought to take every precaution to ensure our community was protected. We followed guidelines set forth by the state, and our Orange County citizens and businesses, with the help of our ad hoc committee, did their part. It came at a very heavy cost, the likes of which we may not fully realize for quite some time. Businesses and their workers took a devastating hit. Some never open again. Families devastated. It is heartbreaking. But because we took this pandemic seriously, because of our community resolve, we have continued to see very low numbers of COVID-19, especially relative to our surrounding counties and region. Which is why I'm pleased to announce that beginning tomorrow, Dr. Clayton Chow, our acting county health officer, will be issuing an order to open campgrounds, RV parks, and outdoor recreation card rooms, pools, racetracks, movie theaters, schools, and day camps, family entertainment centers, fitness centers and gyms, hotels, museums, galleries, zoos, aquariums, bars, and wineries. Further, yesterday I sent a letter to the governor asking that Orange County be allowed to fully open into stage 3, which would allow for additional sectors still being restricted by the state to open. This includes nail salons, youth sports. The longer we wait, the longer these businesses, their workers, continue to suffer. In another bit of good news, I know many of you that have been looking to get your marriage licenses, birth and death certificates, and more. Without in-person services, it was likely more difficult to obtain these vital documents. I want to let Orange County residents know that yesterday, our clerk recorder has reopened in-person services at their offices. It's great to see a vital part of Orange County's services reopen to the general public under the direction of County Clerk Recorder Hugh Nguyen. I want to thank the hard work of county staff for ensuring the health and welfare of the constituents. And finally, there has been a lot of discussion surrounding the wearing of face masks and whether they should be mandatory. We have heard passionate arguments from both sides. While the county strongly recommends the wearing of masks, after a thorough review, Dr. Chow today is changing the order of the county health agency that masks are no longer mandatory. Health officials believe citizens should wear masks but will no longer be required. However, if you are feeling sick, it is strongly recommended to wear a mask and social distance and stay at home. Public health is at the utmost importance during this crisis. In closing, I want to remind everyone in Orange County that we got here by staying strong and following social distancing guidelines. We certainly don't want to reverse our positive trend, which is why I encourage everyone to remember to be safe and follow social distancing as set forth by the federal guidelines. Today, I'm joined by Vice Chairman Andrew Doe and Director of the Orange County Healthcare Agency, Dr. Clayton Chow. Again, I appreciate all joining us today, and I want to welcome Vice Chair Doe to the podium. Thank you.
Thank you, Madam Chair, for the introduction and to bring us up to date on where we have been, where we are today and where we have been with the County of Orange. It's hard to believe that it was 106 days ago that the Chair and I stood before you to declare a local emergency due to COVID-19. We acted swiftly, as the Chair mentioned, even before the first COVID-19 case. We acted swiftly, declaring the local emergency, and we made recommendations to the residents. And the fact that our residents in Orange County took to heart and follow our recommendations very closely with social distancing and good sanitary practices, that I believe that led to the good results that we have seen in the last 3 months. Orange County remains the best positioned county of all the urban counties in California as far as the number of cases that we have, the number of deaths, and on the impact of COVID-19 on our health system. So for that, I want to thank the residents of the County of Orange and also thank the Chair for her leadership on COVID-19. As the Chair also mentioned, we have seen the negative impact on the health, social, and economic components of the county. All of this is due to the response to COVID-19. And we have taken tremendous steps in protecting our workers, in testing our residents, and to identify the populations who are at risk so that way we can try to minimize the spread of COVID-19. And I want the residents of the county to know that your Board of Supervisors, as your elected officials, has heard from you. And we have advocated tirelessly to the state, to the governor, not just now, but throughout the last 3.5 months, to reopen the economy, but do it in a way that is very careful, that is very judicious, so that way we can protect the health of everyone. And today, we are standing with our director of the healthcare agency, and I know Dr. Chow has been in his position just a little over 5 weeks, and really appreciate Dr. Chow stepping up, serving the county at such a much needed time, at the height of a crisis that is unprecedented in our lifetime. I cannot think of anyone that can better serve the county in his capacity as director of the healthcare agency, and also stepped up this week to accept the interim position of serving as Orange County's health officer as well. And Dr. Chow will be announcing the reopening of many more sectors as part of the stage 2 leading into stage 3 of the reopening plan of the governor. And so he will go into more detail in a minute. But let me use this opportunity to point out a few things. We have to guide our action based on data. And what we have behind me, there should be a chart that show the criteria that the state will be looking at in evaluating our status in terms of COVID-19. So with these criteria and the standard set by the state, what you will have is, if we don't measure up to the standards as articulated by the governor, the state will re-examine our status as far as where we are in the reopening process. And so the net result is we are making tremendous progress. We are reopening our economy and our county, but we still have to protect each other. We still have to take steps to try to prevent the surge of COVID-19. I know we expected a surge before, and we really didn't get a surge like we have seen in other jurisdictions. But that doesn't mean that surge may not come. And so the more that we do to protect ourselves, the more that we do to keep these numbers within the standards articulated by the state, the more we will be able to continue to keep opening up our economy. The process will be that if the numbers somehow start to spike, and as we get closer, and especially if we go beyond the standards set out by the state will come down and will work with us to work out a remediation plan. What does that mean? That remediation plan may include impositions of certain practices, more social distancing, maybe face covering, and then in the worst case scenario, maybe even reclosing some of the economy. We don't want that to happen. We know we have worked so hard to get here, and so I would encourage everyone that with the new health order being issued by Dr. Chow, that I still would encourage everyone to maintain social distance when possible, and when you feel you're in a location where you can't maintain that social distance, to wear face covering, especially those who are at risk, the elderly, the people with pre-existing conditions, and people that work in conditions in places where there may be a higher risk of infection. So our residents should remain vigilant, and we should try to not let the virus take hold and maybe accelerate in the future and put our economy in jeopardy again. COVID-19 is still here, all around us, in Orange County and outside of Orange County. There's no doubt about it. As we continue to resume normal activities, we should really do all our part to continue to protect each other. And with that, I would like Dr. Chow to come up. we were hoping to have the monitoring criteria up, but if we don't, then if Dr. Chow can go ahead and walk through some of the numbers so that way the public will be clear as far as what is it that we are aiming for. This is something that the Board of Supervisors has been asking, and I'm very thankful to Dr. Chow for providing clarity to the public to know concretely that where we are in terms of the expectations from the state, and also give the public a sense of like a dashboard report on where we are in terms of our COVID-19 readiness. And of course, as we reach closer to that upper end of the limit, that's when we need to go into some kind of alert that we have to know, we have to increase our vigilance so that way we don't go into the red and have to activate harsher remediation measures that may come down from the state. So with that, Dr. Chow, the floor is yours.
Thank you so much, Vice Chair Doe. Good afternoon, everyone. My name is Dr. Clayton Chow. I'm the Orange County Healthcare Agency Director and the Interim County Health Officer. I'm pleased to share that I am approving the opening of certain additional industries here in Orange County, effective tomorrow. After reviewing our local epidemiological data, including cases per 100,000 populations, rate of test positivity, and local preparedness to support a healthcare surge, vulnerable populations, and contact tracing and testing. Some example of the industry that may now reopen include movie theaters and family entertainment centers, restaurants, winery and bars, zoos and museums, gyms and fitness centers, hotels for tourism and individual travel, card rooms and racetracks, campgrounds and outdoor recreation, public and HOA swimming pools. As interim county health officer, I want to ensure the Orange County Healthcare Agency is acting consistently with our partners at the California Department of Public Health. With the new sector guidance that was released last week, I plan to issue a health officer order later today that applies to all of Orange County. The new order revises and supersedes the May 28th order. Please be on the lookout for that press release and related announcements on our social media sites. The forthcoming health officer order will no longer require that most residents wear a face covering, but strongly recommends that they should when they are outside of their home and unable to physically distance themselves by 6 feet from others. Of course, the other practice are very important, and that is physical distancing, frequently hand wash for 20 seconds, and then stay home when you feel ill. All those measures that Vice Chair Doe had mentioned earlier. It is so important for us to really have to repeat that and remember that. This is consistent with the guidance published by the state for the business sectors that are permitted to reopen. I want to be clear. This does not diminish the importance of face coverings. I stand with the public health experts and believe wearing cloth face coverings helps to slow the spread of COVID-19 in our community and save lives. By being consistent with the state, this will give our business community and individuals the ability to make the most appropriate decision for them and their situation, given the forthcoming health officer order and existing state recommendations. And you heard me say this over and over again. Wearing a face cloth mask is not to protect yourself, but to protect your neighbor, to protect others. We're all in this together. Don't forget that. As you have heard Vice Chairman Doe said earlier, Orange County and Chairwoman Steele as well, Orange County is currently in a great position in regards to the metrics the state is monitoring. And I believe while Vice Chair Doe was speaking, there was a slide on the metric that was appear on the screen. is regarding to that metric of the state monitoring, and the state has assigned a person to work with us closely to help us monitor and make remedial plan should our number are out of range, which is why I'm approving the reopenings of certain additional industries. It is up to all of us to continue to work together as a community to ensure we maintain and improve our health and wellness in Orange County. For more information, including a list of frequently asked questions, please visit our website at ochealthinfo.com/novel coronavirus. Now I would like to invite CEO Frank Kim up for the question and answer portion of this press conference. Thank you so much.
Good afternoon. My name is Frank Kim. I'm the County Executive Officer. Moderator, do we have questions from members of the media?
Yes, thank you. And once again, as a reminder, ladies and gentlemen, if you do have a question, please press 10 at this time, and please limit yourself to one question. Our first question will come from the line of Paul Anderson from the City News Service. Please go ahead.
Frank, there was an update from Seal Beach about an outbreak that they had at their skilled nursing facility, causing their numbers to jump. And wondering if you can give us an update on where you're at as far as the outbreaks in the skilled nursing home facilities, since it appears that a good deal of your deaths are coming out of those facilities at this time.
Thank you for your question. Sorry, boss. I think that would be appropriate to answer this question. What we're doing now is in our website, we are giving it a facelift, hopefully next week, and you will see data as to death rate per city, and we will take out the skilled nursing facility number, and that way it won't muddle the picture. So thank you for your question. We are working on it right now.
Then our next question will come from the line of Nick Gerda from Voice of OC. Please go ahead.
Hi, everyone. Thanks for taking questions. I had a question for Frank on homeless shelter outbreaks. I understand there's been multiple shelters with outbreaks so far of COVID. The healthcare agency won't release info on which shelters have had outbreaks, how many people have been infected at each. I was curious if you could give us an overarching update on how many shelters have had outbreaks, the number of people who've been infected, their status, how often testing is done. And then also curious, we're seeing homeless deaths at the highest level they've been in years. I was wondering what you attribute that to. And lastly, on hospitalizations, the county and state data for OC are both showing the number of people hospitalized daily with COVID has been rising and now higher than the rates for the 3 out of the 4 surrounding counties. So I was wondering if the spread is getting worse in Orange County of COVID, or your understanding of that.
Thank you for that question. I'll handle the question on the homeless shelters, and then I'll turn it over to Dr. Chow to address any changes in our epidemiological data on hospitalizations. So we have had some minor outbreaks in a few of the homeless shelters. As you can imagine, it's a congregate living facility, and the county had stood up many hotels and facilities related to Project Room Key to limit the spread of potentially COVID on the most vulnerable members of our homeless population. And to me, all of the data indicates that the actions that were taken by the county were appropriate and successful. So even though that we've had outbreaks in shelters, we've had capacity within our Project Room Key hotel rooms that allow us to take those individuals and separate them from the larger homeless population within the shelters so as to prevent additional outbreaks. So while we have had outbreaks of both staff and homeless individuals, they've been fairly low in number. As you can imagine, many of our shelters house up to 200 or more homeless individuals. And the number of infections that I'm aware of were generally below 10. And the minute that we are aware of an infection that occurs at a facility, we can be on site same day. We have rapid testing capacity within our public health lab. We are testing all the individuals, and then those that are symptomatic or those that are at higher risk, we're immediately transporting to the available shelter beds that we have within our hotel program. And at that program, they're being cared for with clinicians. We have nurses on board. We have food assistance available and security. So that whole program that has been set by the state and the county has done an outstanding job of implementing, has prevented the widespread infections and the large outbreaks that could have occurred within our homeless shelter program. So I consider that to be a wonderful success, and I really want to thank our staff and also our contractors that are participating in that, Illumination Foundation, and we absolutely also support and appreciate the emergency workers who have so quickly responded to those outbreaks that have occurred. So those are my responses and comments. I'll turn it over to Dr. Chow. I think you had questions about the rising number of hospitalizations.
Hi, Nick. Clayton Chow, thank you so much for your question regarding the hospitalizations. So yes, while there is a increasing number of people who are hospitalized, which also fluctuate, but that's expected as the number of people who get infected increase. One of the measure on the monitoring criteria from the state is whether or not the county, the last 3 days of hospitalization remain within 10%, and we are doing well on that. As is related to how we are faring comparing to other county, our daily COVID-19 related hospitalization rate is 9 per 100,000, where LA County is 13.6, San Diego County 8.5, Riverside County 9, and San Bernardino County 8.9. Overall, California is about 7.9. So I'll be happy to provide more answer to your question, Nick. Thank you.
Our next question then will come from the line of Spencer Custodium from Voice of OC. Please go ahead.
Hi, thanks for taking our questions. With the rising hospitalization rates and, bars, gyms, movie theaters, everything opening up tomorrow, why peel back the mask mandate? And also, what do you say to private and public employees who might be concerned now that masks won't be required by the public, but yet strongly encouraged? And Dr. Chow, you had still stood by, masking up, and I'm speaking with epidemiologists, and, one of them had considered it a step backwards. So why, move on the masks now as opposed to waiting, the nearly 3-week incubation period to see if there's a spike in cases?
Thank you for your questions. And yes, I have worked with our internal epidemiologist staff, as well as our academic epidemiologists from other academic institutions, and we talk about this. The reason is we want to be consistent with the state. So if you look at all the state guidance to the business sector, the language around face covering is should, and we don't want to cause any confusion in the public as well as confusion for the public sectors. The other things is you've heard we talk about if our number ever go out of range, we have to submit a remedial plan to the state. And so the option would be take drastic measure or closing business down. So if we don't have a way to become more drastic in our public measure, then we will be forced to reclosing some of the business sector. So this is one of the ways that we will be working closely with the state on. But most importantly is we have to be consistent with the state. Looking at all of our number now, that we are comfortable that we are in a good place. So.
Okay. Then our next question will come from the line of Alicia Robinson from the Orange County Register. Please go ahead.
Thank you. And this is kind of building on the question that Spencer just asked. I guess it sounds like, if I'm understanding you correctly, you're saying that, potentially requiring masks at some point is sort of a tool in the toolbox if the county's numbers go up and you see a really alarming spike in cases. But I guess to that I would ask, if you are decided not to require masks already facing a bunch of pushback from the public. Why would we expect anyone to listen if the county tells people later that masks are required?
Thank you for that question. I want to make sure that this decision is not because the public pushed back on it, and we are not taking the mask away. We strongly recommend that people need to wear masks, and we want to be consistent with the state. I don't know how else to explain it. And clearly, if we get to a point where we have to make a decision on what to do, at that time, then it will be impingent upon all of us to enforce the mask order if we need to go back to having a must, because currently there's no enforcement on the mask order.
Our next question now comes from the line of Amy Texan from the Associated Press. Please go ahead.
Hi, thank you so much. And yeah, following on the two previous questions, I am still seeking a bit more information. On Tuesday, you said at the Board of Supervisors meeting, and you gave a very lengthy explanation of the reason for waiting to make any changes on the previous mask order. And you said that you would want to possibly reconsider it in 2 or 3 weeks when the ecosystem had sort of stabilized after all these changes we're making tomorrow. What has changed between Tuesday and today that prompted you to make that decision that Tuesday you said you wouldn't be ready to make for 2 or 3 weeks? And my second question is just a clarification on the sectors opening tomorrow. Are you allowing for the reopening of all the sectors allowed by the state and announced by the state last Friday? I didn't hear you mention some of them, and I just want to know if you're allowing for all of them. And if you're not, why are you holding back on any of them? Thank you.
Thank you for your question. I guess the second piece of your question, the easiest one, yes. Any sector that have a guideline posted on the CDPH website with an effective date of June 12th, they are allowed to open tomorrow. Okay. So first question is because the monitoring criteria from the state just came out a couple of days ago. So on Tuesday, I did not have time to look at them carefully and see where we at as a whole county. So after digging into the monitoring criteria that we spoke earlier and talking to staff, talking to epidemiologists, talking to academicians, I'm comfortable that we can pull back on the mask order for now. And again, it is not taking away, but changing from a shall to a should. And I want to repeat, strongly recommend that we still have to wear masks. Thank you.
Then our next question will come from the line of Jessica DeNova from ABC7. Please go ahead.
Thanks so much. That's Jessica. So I'm guessing this would be best for Dr. Chow. Dr. Chow, over the last week, we have seen 3 of the highest spikes in our new case numbers. When we last saw spikes, you had mentioned that it was because of cases that we saw in congregate living facilities, like skilled nursing facilities. To what can you attribute the spikes over the last week? I think today was the 3rd highest number.
Thank you for that question. So if you ask me, I probably would suspect that this is the remnants of what happened over the Memorial Day weekend. Our contact and tracing team are working to make sure that we ask people when we contact them and tease out where they at, so we can have a clearer picture on truly where did this happen, right? We expected that. So I hope I answer your question. Thank you.
Then our next question will come from the line of John Earl from the Associated Voice. Please go ahead.
Yeah, that's Surf City Voice. My question is regarding the aggressive challenging of factual reports and orders from Orange County health officials at previous board meetings. So maybe Michelle Steele is the one to answer that. And the fact that the COVID case average trends are steadily growing, including the death account, which has surged from 150 on June 2nd to 202 today. So my question is, are you challenging the scientific credentials and facts that were presented in the past by health officials, and if so, based on what? or are you making an ideological stand, such as to say that we should reopen regardless of health consequences, including extending lockdowns well into the future and a much larger number of fatalities? Thank you.
So thank you. Chairwoman Steele had to step away. I believe I can address those questions. First, I did not believe that the board members were challenging the scientific criteria. I believe the questions were really regarding what is the scientific basis for the recommendations that came from both the CDC as well as the California Department of Public Health. And in fact, if you go to the CDC website and you do a search for face coverings, they do identify, there's a listing of all of the most relevant research supporting the recommendations on face coverings. That is available on the CDC website. I think part of the challenge that we're facing within our overall community, and I believe this is the case not only for Orange County, but in all counties throughout California, is that this COVID issue is relatively new. It's been it's been in China since approximately November. We really began to deal with this in the United States sometime in the January, February timeframe. So it's relatively new. So when we get into issues of what is the proper treatment, what is the proper way to reduce infections, the common sense items regarding, washing your hands and all of those safety precautions are, while they make sense, when we get into the specifics of what is the effectiveness of a face covering as it relates to the transmission of COVID, I think it's still very early on in the process. So a lot of the guidance that you see has been changing, both from CDC and from the World Health Organization and from the California Department of Public Health, because new information is constantly being brought into this space. So what I would say is that as the board members have questions, what they're asking really for is information. And that information is changing, but we are providing that information both to the public. It's available on the CDC website, and that is a dialogue that we're having. So I didn't see that as an ideological issue. I know that certainly there are members of the public that did express their First Amendment right, and I do believe that many of their questions were not only on science but also on ideology. But the discussions that we've had with our board members really have been about the medical science. So thank you for that question.
Our next question then will come from the line of Matthew Leslie from the Fullerton Observer. Please go ahead.
Yes, following up on the previous answer, Mr. Kim, if the guidance from the CDC and the WHO is indeed changing, shouldn't we be more cautious than less cautious?
No, I don't think so. Because what's happened is early on in this COVID process, we saw no recommendations from both of those organizations related to face coverings. In fact, we were early on in that process and discussions about, as you recall, there was a business guidelines action by the board where it recommended face coverings for employees that were working in essential sectors. Then in April, I believe there was a motion by Supervisor Doe and Supervisor Chafee that was approved that required face coverings for employees in pharmacies and grocery stores, et cetera. So I think the county has always been addressing these things as that information has been changed and modified. And now what we see is there's a recommendation from the California Department of Public Health. There is a recommendation from the CDC. And we also have a strong recommendation that is coming from the County of Orange. I think that we are aligned. I think there are questions about whether should we have maintained a face covering order or not. But I think as addressed by Dr. Chow, if there isn't an enforcement component and we are using our opportunity to both educate and engage members of the public and our board as there are questions, we think that that'll be a much more effective way to encourage the appropriate use of face coverings. All right, one more question, please.
We have a question from the line of Brandon Foe from Voice of OC. Please go ahead.
Hi, thank you for taking my question. My question pertains to the county's main COVID-19 case count information page, also known as the OC Health Info page. What we're seeing on those public data sets is an assessment of the virus's impact on congregate living environments solely through the scope of jails and skilled nursing facility residents, when in fact there are other types of environments, right? There are care homes, assisted living facilities, homeless shelters, where there are homeless seniors and vulnerable people with disabilities and existing health conditions, and those are detailed in the MOOC reports. So my question is, why aren't we accounting for those groups, facilities, and populations in the case counts on the OC Health Info coronavirus case count page?
No, I appreciate your question. And what's happened is, obviously, over time, you've seen our webpage evolve. Same as in other counties, we've seen their web pages evolve. We've received quite a bit of questions and information requests from city mayors. They've wanted to know what is the death count information as it relates to each city. We have had questions from the media. Why is it that your data doesn't align perfectly with the state data in terms of hospitalization of beds, et cetera? So we have made some adjustments to that already, and there'll be further changes that come in the near future. And I believe there's additional input that Dr. Chow would like to provide.
Yeah, thank you for that great question. And I know since I came into this role, I've been looking at our website and want to improve it. So the order for staff is to look at the best data platform information that are public facing. And so I believe that we have chosen the Johns Hopkins platform. Several counties in California have followed the Johns Hopkins data platform. So we will make changes coming soon. So it will be very interactive, and I think you all would like it very much. So thank you.
Thank you. I think we have time for one more question.
Thank you. We have a question from the line of Norberto Santana from Voice of OC. Please go ahead.
Yes, can you hear me okay?
Yes, I can. Go ahead, Norberto.
Thanks for taking questions and taking for the time out. A couple of quick questions, maybe two for you and two for Dr. Chow. One is just, I heard other things like gyms, pools. We're getting a lot of questions about youth sports and kind of why youth sports are not being opened, but other uses are, and just if you can provide a little bit of clarification on that. And then secondly, Frank, maybe you can take this one, is looking at Dr. Quick's resignation earlier this week. Do you see yourself as anything as county officials needing to do a better job of public information on some of these orders, given that there's been, confusion around just sort of how these are interpreted? And the two questions for Dr. Chow is how do you balance your responsibility as the state, as the local state public health officer, and the fact that you do work for the Board of Supervisors, who seem to have a very different opinion on the things like face covering? And on face coverings, do you feel at all that you've put workers at risk? Because by not having a mandatory face covering now, even though it wasn't being enforced, there seems to be a concern out there that we're hearing amongst workers that their employers are no longer allowing them to wear masks at work. And so it may be creating some workforce confusion and potentially putting workers at risk so that you can open the economy faster. A tough choice there, but I'd like to hear your thoughts on that. Thank you again.
So I'll try to remember those questions. So let me try to get to the first two, Norberto. First of all, I think you had a question about youth sports. So we had a call with Secretary of Health and Human Services, Mark Galley, last week on Friday. That question was specifically asked as to why, when will we see guidance from the state related to youth sports? His response was that it would occur in the very near future, but that today it was not permitted. So we do know that that is something that the state is taking quite a bit of input on, that there is a strong desire, particularly with the summer months coming, that those parents with young children that generally are engaged in this type of activity would like to see a return of that component of our industry. We'd like to see that as well. I know Supervisor Wagner has been a very strong champion of wanting to see youth sports be resumed in Orange County. We'd like to see that as well, so we eagerly await state guidance on that particular industry sector. Related to Dr. Quick, on her resignation. I know that I had spent quite a bit of time. Obviously, the CEO works very closely with the health officer. She and I had many conversations about all the things that are related to her responsibilities on the COVID response, and as it relates to the management and direction of the county executive office. So we had a number of conversations. As of the prior week before the resignation, on that Saturday, she and I had a very good conversation about things that would, the questions that would come from the board the coming week, things that we were working on. So it came as a surprise to me when she resigned on Monday. I was very disappointed to see her resign. I think she's done an outstanding job for the county. And in fact, I think many of the things that have gone well in terms of Orange County as it relates to COVID are directly attributable to the actions that occurred within our healthcare agency from her leadership. So absolutely. Am I concerned? Am I disappointed? Sure. We don't like to see as much transition as we've seen in the county in our healthcare agency. But when we look at each individual case, there were reasons for why those transitions occurred. Starting with Richard Sanchez, he had a planned retirement. That is, in fact, he stayed about 6 months longer than what we anticipated. He and I had ongoing discussions up to a year before he left about the timing of his departure, and I was appreciative of the amount of time that he spent with us. And with Dr. Quick, that came as a complete surprise to me. It's not a great situation for us to transition health officers during the middle of a crisis that we're in, but she's left us in a good position, and we appreciate all that she's done. So with that, I'll turn it over to Dr. Chow.
Thank you, Mr. Kim. Thank you, Roberto, for those questions. And actually, your question for me are great questions and give me a chance to respond. But I want to say a little bit about Dr. Quick. I think Dr. Quick's departure is a great loss to this community, certainly is a great loss to HCA. And I haven't finished my mourning period yet on her departure. So I want to publicly thank Dr. Quick for all of her compassions and all of her hard work and commitment to the public health and to the wellness of our community. But back to your question, Roberto, I hope that I'm up here very consistent, and you've heard me say that at the board meeting, is that I will always stand by science, even though I work for the board supervisor, but I believe that they're hiring me to give them the science. That's all I know. And you probably have heard me talk about how I don't speak politics, and that was taken out of context. What it means is decision that we made at the healthcare agency will always be based on science. The second question that you have is a good question. I think the confusion has been, unfortunately, is that when the state issued the guidance for each of the sector, in the guidance, the language said strongly recommend face covering, and we have also created certain conflict for some business sector as well. And so I had conversation, as I mentioned earlier, with several businesses and an individual in the community before we made the decision, and that is we want to make sure that we are consistent with the state and not open for confusions and conflict with the state, which will create for the sector who trying to complete the checklist on the guidance. And so that's the whole point of this. Certainly, each businesses, we advise them to have their own legal counsel as to whether or not they go stricter than the guidance. That is up to each of the business sector to decide. So thanks so much, Roberto, for that question, because I think that those are important points that I want to get across to the public as well. Thank you.
Well, thank you for that. That concludes our press conference for today. We look forward to having additional briefings for you next week, Thursday. Thank you.
Thank you, ladies and gentlemen. That does conclude our conference for today. Thank you for your participation for using AT&T Executive Teleconference. You may now disconnect.